Good morning, everybody. Appreciate you all coming down. We wanted to just give you a brief update on the situation. As you know from yesterday, we have closed Town Hall to all visitors, but those having business transactions that are time sensitive, that will be done via appointment. We have closed the Eastern and Western Granite Civic Centers and the playgrounds, but we'll have kept the parks, beaches, paddleball, and tennis courts open. We will be monitoring those venues that are open on a daily basis. We'll be making an announcement later today about hair salons and nail salons. Having declared a state of emergency yesterday does give this office the power to close certain businesses in addition to town functions. So we are looking closely at everything. We want to stress to everybody who lives in a building or a complex with more than one unit to please remember social distancing and common areas, try to avoid them, and to continuously wash your hands. As of today, I think the state of Connecticut, or as of last night, had about 49 confirmed cases, 20 from one town alone. Here in Greenwich, we now have 6 confirmed cases. Again, just to reiterate, we need to remember social distancing. You may feel fine and everything is okay with you, but we just don't know at this point. And while you may be okay, somebody else next to you may not be. So just to remember, whenever and wherever you see kids, they're out of school now. We want people out. We want them out exercising and walking, but to do so at a distance. So with that, we are having daily meetings. As you can see, we have Chief Szynski of the Fire Department, Joanna here from the Health Department, and Chief Evie from the Greenwich Police Department. We're here to answer any questions that you may have at this point. We cannot release any names, so if that's a question, one that I'll tell you we will not be answering, but we do have 6 confirmed cases.
So as of yesterday, though, it was 1, right? Correct? Now it's 6 or
No, yesterday there was 3 confirmed, but there was a couple non-confirmed that I'd seen last night. Now we have 6 confirmed. Ken?
The other day that you were in close contact with Governor Lamont, what is being done to ensure that Greenwich Hospital has the number of tests it needs to be able to help people get the physician going?
Sure. I mean, that's a constant battle. They're doing this on a state-by-state basis, and Governor Lamont's concern is that a state like Connecticut, which is smaller than a state like New York, but has regions in it like Fairfield County and towns in it like Greenwich, his hometown, which are very, very close to some epicenters of the outbreak, more so than maybe some of the rural areas in New York. So the state of Connecticut is out there, every day pushing for their share of these testing kits. But Greenwich Hospital, we're in touch with them. As I mentioned yesterday, Senator Murphy has been in contact and called the office, as has Representative Himes, who showed up at our last meeting here on Sunday. And also, we're speaking on a daily basis with mayors and first selectmen in our neighboring towns, including across the border in New York, and sharing what we're all doing. Pretty much we're all on the same page, but we want to make sure that we're sharing ideas and best practices going forward.
Have you done any pushback from any of the local businesses that had to be closed? I know it was under the state order as well. People saying, everyone's saying this is cutting off our legs right now?
No, they're concerned. I mean, they're reaching out, but they're also concerned about their health and that of their customers, and they know that there's not many people going out. Several businesses are stepping up to the plate, and I'll mention a few of them right now that have reached out. Chicken Joe's is delivering all over the place. Upper Crust Bagel is now doing lots of things and have reached out. Stop and Shop will now be opening up earlier, and from the hours of 6 a.m. to 7:30 a.m. will be serving people 60 years or older. So we're starting to get this now, people stepping up, and I would just urge our residents to shop and buy local at a distance, order and do the takeouts and whatever you can do. Even buying gift certificates to be used at a later date would certainly help these vendors and these businesses.
How is Gems doing?
Gems is, they weren't here today, but they are in contact with us every day, and usually at all these meetings. So far, so good. We haven't heard anything out of the ordinary.
Are they transporting any of the 6?
That I don't know. I mean, we don't know. But we can get you that answer if you circle back later. Ken?
Perhaps Chief, you can answer this. Is there any subjective fines for people who do not listen to the order about closing restaurants to sit down and see, whatever you're going to say about nail against lines?
Right, again, under the executive order, there are statutory obligations for those establishments. Right now, though, we're getting very positive voluntary compliance, so I don't think that's going to be an issue. And then we'll just work it backwards. If we do get complaints, we'll address it. But so far, it's been, again, there's a spirited community. These are all local businesses that are going to do business here for many years after this. So, again, they're understanding, they're calm. And again, a lot of them have stepped up to the plate, as First Selectman Camillo has mentioned, and including some fraternal organizations like the Knights of Columbus, who are volunteered to partner with seniors who might need assistance to do that shopping. So a lot of positive stuff has really come out of it, and everyone's been compliant. We had no complaints at all over the night, over this, since 8 o'clock when all of the shops closed. So.
But you would have the power to fine them if they did.
That's correct.
I'm glad the chief mentioned the KFC has stepped up as a third-degree member since 1982. He shamed me and that I forgot to mention them, so thank you. I'm already in trouble.
For these 6 people that have been part of this case, were they all in contact with each other? Is there any concern for spread outside of these people?
So what we do is do a contact investigations on people that are positive. We interview them, we interview the contacts. The good thing about at least those 6 individuals that we had, that they isolate themselves right away before they got tested, so that they didn't expose anybody else, didn't expose their family members. And we just monitor them daily, and whoever they were in contact with, we monitor them daily and check for symptoms and temperature and things like that.
I couldn't quite hear you. You said they did isolate themselves?
Yes, they did. Yes.
Are any of the 6 in the hospital?
1.
Fred, you talked about the whole setting inside the apartment complexes. Obviously, there's a lot of there's the housing complex on Court, and senior housing as well. What are you doing in coordination with Housing Authority to help residents there if they need them?
Sure. So I spoke with the housing. We called them and they had them come in. We had them come in on Sunday to update us on that, and they are on top of it. But I had mentioned that anything the Office of First Selectman can do this week, promoting the message and getting the word out. They said they were on top of it, but we were just concerned because there are community rooms there, and there may be some people that may be at risk in those, we know that are at risk there. So we just want to stay on top of that, make sure that they have all the information that they need to make the proper decisions.
And you feel there's good forms of communication with you and the Housing Authority and the state and other municipalities right now? No roadblocks?
Yes, and I do want to make sure that and emphasize that any organization, as well as departments in Greenwich, update their websites continuously. And I would say to the public, be cognizant of what you read. You're going to hear lots of things that are not true. Please do not forward information, especially what you see on the internet. A lot of that could end up hurting people and placing people in harm's way. So get your information confirmed first before you pass on anything. You know, out of good intent, something bad could happen. So please refrain from forwarding things on, whether via email, Facebook, Twitter, or Instagram. LinkedIn.
Again, with the six that are diagnosed, were they in contact with each other? Is that how it spread? Like, were they out of the country? Can you release any information on that?
Not if they were in contact with each other. I believe, let me just think about it, but no, I don't think any of them were out of the country. So, as far as I know. Okay.
And none of them were in contact with each other?
That I cannot tell you at this point.
And how is obviously first responders can't stop working. What measures are they taking to stay safe during this time?
Thank you for the opportunity. So, emergency services, fire in particular, we meet every day at 11 o'clock. We've modified our emergency response plan so that we minimize the exposures during response. We have locked down the fire stations, so public is not allowed in the fire station. Non-responding members cannot respond into the fire stations as well. We constantly look for the community's help as well. As much as the anxiety levels are out there for everyone involved, there are a specific set of questions that start in our dispatch and communications center. So people are asked specific questions whether or not they're suffering from any symptoms of COVID-19. To that end, it's important to be honest, because our responders' level of protection is geared to the information that they receive. We will continue to monitor the situations. We have contingency plans both for staff and for station closures, and we'll continue to go on and do what we do. It's a great opportunity to thank the healthcare workers and our emergency responders, the town leadership and state leadership as well, because they are providing great guidance and information. The difference we have in dealing with this situation as opposed to, say, a Superstorm Sandy or a hurricane or something that comes through, is communication levels are up, so we are able to communicate with each other. We know exactly what's coming forward to us, so we can plan accordingly to that.
Has there been any dip, let's say, in police activity, fire activity?
Yes, and all three services have had a dip in the calls, but what we're using that time for is to kind of protect our force and get them ready for the inevitable increase in calls, which is going to happen. So, and on that note, Captain Gray, who's the captain of patrol, he has an update for GEMS that he's going to give us.
So, I guess it's just a continuation of the cooperation that we have between all the public safety. Your question about what's going on with GEMS, I stepped outside and I made a phone call, and I spoke to the director, Tracy Scheitinger, just a few minutes ago. So to answer your question, she's unsure if any of the 6 confirmed cases actually came through GEMS, but this is part and parcel of what they plan for in any pandemic. And so they're continuing to follow the plan that's been in place for any type of pandemic. So far, their response, there's been no detrimental effect to their delivery of service for their personnel. And so they're continuing to do what they've trained for each and every single day. You're welcome.
Thank you, Captain. Any other questions? Okay, thank you very much. I want to wish you all a happy...
Next briefing like this be?
We will let you know. We're meeting daily, so it may be daily, but we will certainly let all of you know ahead of time.
When do you foresee that announcement about the nail salons coming out tonight?
Within a few hours.
Get your nails done.
Oh, yeah.
And your haircut.
Yeah, both of them.
Well, I want to again wish everybody a happy St. Patrick's Day. When I got up, I had to grab my glasses this morning to make sure that I grabbed the right pin and not the red, white, and green. I had to get the red, white, and orange because I wanted to get off on the right foot with the chief today.
And later today, the PIO from the police department will have some pictures just in an effort to, again, recognize the holiday and to try to provide some normalcy. The police department, we had, again, you can recognize there's a number of us that are of Irish descent. So with social distancing and proper hand washing, we raised the Irish flag at Town Hall this morning at 9 o'clock with about 15 officers who were either past parade whistleblowers or grand marshals, or just were Irish or wanted to be Irish, like Lieutenant Zuccarella. So we appreciate that. Again, we're just trying to get that out to remind people as best as possible to be normal. And I think we close all of our 10-15 meetings with, a reminder to be kind. People's stress is going to get up, and you want everyone to just to cooperate, help each other out. Again, some of the fraternal organizations like Knights of Columbus helping out, but someone can help a neighbor and still do proper social distancing, especially the elderly or infirm or someone who's not normally able to, would normally be able to get services and has limited abilities now. So again, just remember those people.
Final question. So say your elderly neighbor calls and say, I don't feel good, I can't stop coughing, I can't breathe. What do you want proper procedures in town? Do you want EMS to handle that and be like, okay, I'm going to call 911?
If they call 911, we'll triage the call, and then if we'll send the ambulance. Something like what you just said, an elderly person, difficulty breathing, that's going to be a police officer, and GEMS would respond, because again, we're the first responders. But if it's somebody who's having flu-like symptoms and isn't in a high-risk group, then they should contact their personal physician, and if the appropriate symptoms are there, they'll give them a prescription so they can get an appointment at Greenwich Hospital or one of the other agencies that tests for the flu and the virus, and go from there. But if you're a healthy person who's having some minor symptoms, don't use 911 for that. But in the description of this hypothetical you gave us, that would be appropriate to call 911. Absolutely.
Okay. Captain Gray?
Without consultation, but just to talk about expectations, I probably counsel that we probably don't want to have another such gathering here if necessary. So I think as we talk about circulating information, we're going to optimize technology and maybe adopt a different way in which to put out this kind of information. Whether it's, we're definitely going to send out regular briefings via email the way that we always have. And so that information will definitely go out, and if there's an opportunity for maybe some questions and answers, I'm sure there's some technology that we can work out for our local media.
Sure. Okay.
I would say no expectation that we're probably going to set up like this again. That was what we want.
Yeah, I mean, I know we were at the hospital and did one yesterday, and they practically, as soon as it was done, they threw us right out. So, yes, they did. So we're certainly cognizant of that. So thank you, Captain Gray. I want to thank you for your update with GEMS, Chief Szynski, Chief Heavey, Joanna from the Health Department. As you can see, we're very lucky here to have such great public safety units here in town. We're second to none in the state of Connecticut, as far as I'm concerned. So we will stay in contact with you. Be safe, and again, happy St. Pat's Day.